In this video, I'm going to talk a little bit about the gastrointestinal symptoms that patients with a dysautonomia can experience. So the gastrointestinal system receives a significant nerve supply from the autonomic nervous system, and it is not at all uncommon for patients with a dysautonomia to report gastrointestinal symptoms. This is complicated by the fact that gastrointestinal symptoms are just quite common on their own. And irritable bowel syndrome is quite a common condition, so it can be hard enough to distinguish between symptoms that relate to the dysautonomia and symptoms that coexist with the dysautonomia. And the reason it is important to make this distinction is that the symptoms that occur as a result of the dysautonomia, so for example, if you have nausea and you report that it definitely gets worse when you are standing or when you are upright, and it gets worse if you have other symptoms like palpitations or lightheadedness, then there is a high chance that the treatment of those other symptoms of the dysautonomia, be that through the exercise or the blood volume expansion with the salt and water or the medication, should also treat the nausea as well as the other symptoms like the lightheadedness and dizziness. If, however, the gastrointestinal symptoms occur independent of the upright posture, so they're not really related to a change in your posture, then they are less likely to respond to the treatment of those other symptoms of the dysautonomia. So it is important to make the distinction so that patients can know what to expect from their treatment. So there is a whole list of different gastrointestinal symptoms that can be reported, and I'll just describe some of these. So like I've already mentioned, nausea, a lot of patients do report nausea, and it is not always reported as a postural symptom. And so in that case, it's just important to go through the history. When does the nausea occur? Is it associated with headaches? Is it associated with anxiety? Is it associated with any particular type of food you're eating? Is there vomiting with the nausea? So all of those things will need to be established so that your healthcare professional can further direct your management. Another commonly reported symptom in a dysautonomia is what is referred to as gastroparesis, and this just essentially means a slowing down of the passage of food through your gastrointestinal system. And this tends to present with symptoms like feeling full quickly from eating. There can be bloating, abdominal distension, nausea, constipation, can all be symptoms of a gastroparesis. It can be difficult to definitively diagnose because the only test really for it is called a gastric emptying study, and this has many limitations, one of which is that it's not really available in most hospitals in Ireland. It's also really unpleasant for the patient, and even if it's normal, the patient is still suffering from symptoms and the management won't be that different for the most part. So the mainstay of the management is to have more frequent, smaller meals as opposed to less frequent, larger meals. And then you can look at dietary modification, so that should be done in conjunction with a healthcare professional, but you might be looking at kind of a low fibre or a low fat diet, but I wouldn't be making any drastic changes to your diet without getting an individualized approach to that. Some patients will go on prokinetic medication, one of those is called metoclopramide. Some patients will go on antibiotics. But it's important to note that these are really for a shorter term relief, and they're not advisable to be used in the longer term. Some patients will report bloating and abdominal distension. The mechanisms underlying this are poorly understood, and a lot of the management will be based on the constellation of symptoms that you're reporting. You may end up having an endoscope to look to see if you have gastric ulcer disease, could be contributing to your symptoms, or if you have Helicobacter pylori, which can be treated with an antibiotic. So those kinds of things are checked. Heartburn and dyspepsia can also be reported from time to time, and again, the management and the treatment of that will really focus on the evaluation of the symptoms, and you may end up being put on something like a proton pump inhibitor. For the abdominal distension, sometimes a prokinetic medication is given. Some patients find probiotics help with their symptoms, but it really will be an individualized approach. Lastly, there can also be symptoms like constipation and diarrhea, and a lot of the time those symptoms overlap a lot with those of irritable bowel syndrome. And again, the management will come down to similar management to irritable bowel syndrome, so things like exercise, cognitive behavioural therapy, and then whether or not you would need different medications. Maybe it would be a prokinetic, maybe it would be laxatives, this kind of thing. Dietary changes, sometimes the low FODMAP diet is recommended. But again, all of these warrant a clinical evaluation before you would start any of them. But I think it's just important to highlight the fact that gastrointestinal symptoms often coexist with symptoms of a dysautonomia, and it's very important that they get evaluated as part of your initial assessment. And if you do need further investigation, that can be organised. If you do have gastrointestinal symptoms and you also have symptoms such as fever or weight loss, or if you notice there's blood in your stool, or there's a family history of something like colon cancer, again, that'll take higher priority in terms of getting that evaluated. And you probably would end up having a scope just to make sure there isn't anything else underlying your symptoms. But by and large, they're very common and they are usually quite well managed if an individual approach is taken. So I just wanted to give a quick overview of the gastrointestinal symptoms that can occur in a dysautonomia, and to explain why some of the symptoms may not respond all that well to the treatment of the dysautonomia in terms of the symptoms of lightheadedness and palpitations, because I think that can be quite challenging for patients, and I just thought it would be useful to explain it.